Hi, everyone. Welcome to our Outbrief and Wrap-up from this week's e-workshop, BPM Plus Health. This is Tracy Berardi, Program Manager, joined again by Ken Rubin, our community convener, and all the working group chairs. A couple are still hopping on because we've just come off of some great working sessions this week. So thanks for joining us, and I'll turn this over to Ken to get started.
Yeah, I'd just like to take a minute or two. First, just to thank everybody, starting with the co-chairs. I think it's been a very productive week. I was able to make it to, I think, every work group, at least for a little bit. And, you know, the work and the esprit de corps that was happening, I think was commendable. I think our work group leads all did a fabulous job. So virtual round of applause to all of them, and special thanks to everyone, you know, who dialed in and took time to contribute. So I think we made the best of the circumstances and ended up with a very positive week. One or two things I did want to draw attention to. First is we mentioned in the opening 2 days ago that we're looking at organizing a kind of a community response to figure out where BPM Plus could potentially assist with regard to COVID-19. And we've cobbled together a list of use cases that we think are areas which we might be able to contribute, and have a newly minted sign-in sheet, so people can indicate, you know, which activities that that each of you would be willing to contribute some time to. So I'll post the link to that in just a second. It's a Google Doc. Just add a column with your name. We're asking basically for two things. If you're not known to us, please include your contact details. Put your name. We're asking for the total contribution of time you might be willing to make. So if it's 4 hours a week or 2 hours a week or 1 hour a week, whatever that is, it's valuable. So let us know kind of the aggregate, and then use case by use case for those that you would be interested in rolling up your sleeves on. Indicate whether you see yourself playing kind of a major role, a minor role, or just a liaison role. So it might be that you're not the expert on that, but you know the community that is, and you're happy to connect the dots. So I'll post that link momentarily in the chat. The second is, I think there are some BPM community opportunities for grants and so on that have been making their way around the lists. I know in particular Pete Melrose had something that's out on the BPM announce list. So I just encourage everyone to take a moment, look at that, and if that's something that's in your sweet spot, you know, go ahead and get in touch and let him know that. So without further ado, I'd like to move on to our first report out. And we've asked the work group leads to talk a little bit about, you know, what was done this week, what their next steps are, and if they identified any challenges, you know, that we need to be aware of. So without further ado, I'll pass it to Jane and or Terry.
Go ahead, Terry.
Hey. Can somebody bring up the slide? Is it up there? And I just not opened my camera. Sorry, guys. Oh, wait, I don't want you to see me. That was a mistake.
Hi.
I'm sorry. I just got off a 3-hour webinar, so I'm a little goofy right now. Okay, so we did the adoption working group. We had a ton of people coming in and out, many changes throughout, but it was actually wonderful. And there were a lot of new people that came and contributed heavily, and we're very grateful for that. So what we did was we reviewed our maturity model. You guys are aware we presented that on Tuesday, just a brief teaser of what that is. We do have some comments that we gained during this, some, for instance, related to privacy and security that we still need to reconcile. We did create an outline for the adoption playbook after having lots of dialogue about what an adoption playbook was. Was it adoption of CMM or adoption of clinical practice guidelines? We came to the conclusion that it's clinical practice guidelines, but it's the use of the CMM that will enable us to get to that adoption. So I think we're in a good space. We are actually today, somebody's in the process of putting our outline into a document, and hopefully we will see a lot of people contribute to that. We discussed the need for metrics, so we didn't agree on metrics, but we understand that as we go through this process, we will garner more information about them. We discussed also, we took about 15-20 minutes to discuss the COVID-19 options that Ken had presented on this call previously, just to give people some additional information and insights into where they came from and what might be options for people's participation. Our next steps is continue to distribute the CMM, reconcile comments. What we know is these are iterative and living documents, and they only get better with different people's eyes on them from different people's experience. We are hopefully, once we get this playbook section document out there, which will be once again a living document on a G drive, I'm imagining, we are hoping people will sign up. We have had a few people indicate that they're interested in parts of it, and our goal would ideally be to have a first draft of the playbook for Orlando. If we calculate correctly, that's about 3 months from now, and hopefully we will be able to do that. We will reinitiate our meetings with an every 2-week cadence. We would invite anybody to participate in those meetings. What both Jane and I feel is that even if you don't do work in that interim 2 weeks, sometimes Jane and I don't either because we're too busy, just having your participation in a working session, which is what those 2-week meetings are, is invaluable. And you can see this issue concern that we want to ensure that the artifacts created by other work groups are complementary to each other. So I think that that is just going to require some logistical figuring out. And Ken, there's also, I think we're going to be using Atlassian tooling to make everything available, or somehow to open it all
Yeah,
up.
so I can jump in on that. So HL7 has done a tremendous job of configuring Atlassian for work group use. And we're in the process of seeing how much of that homework we can steal and standing that up. So I've got someone working on that now. We have access to the Atlassian environment already. So as soon as we can get that configured and out, we will do that. It's a top priority for us. And we'll have Atlassian spaces for each of the work streams.
And Jane, do you want to add anything?
No, I think you covered it really well.
Well, I have to give Jane credit. She did that slide. I just read it.
Wow.
So thanks for doing it.
You did all the work at the meeting, so.
So, okay, we're good. Thanks, Ken.
Thank you. Authoring.
Okay, thank you so much. So I'll go first if that's all right, Pawan, and then you'll do cleanup. I think you do a great job at that, if that's all right, summarizing. We had 21, and thank you. We had 21 individuals that few did come and go, but we had a very good core group. I want to thank the group and thank our sponsors and Ken and Robert for being active participants. So folks, we had experts, brilliant minds that we did roll our sleeves up from the consulting field, as well as several physicians. We had several physician and other societies represented by PhD. We had a cognitive psychology specialist, BPM architects. We had folks from University of Utah, professor of medicine and biomedical informatics. And we also had, I just want to put a shout out to the American College of Obstetricians and Gynecologists, and of course the American College of Emergency Medicine Physicians. 21 people strong, and I hope that everyone hangs in there with us. We had some great, what I would call sound bites, if you will. Folks came to the table with the attitude that delivering care from PDFs was something that no longer should be sustained and or even considered at this point. We had a lot of talk about the why we're doing this, and some of the great things that were said was Just want to be clear, problems come to us and we need to be able to solve them to provide real clinical care. We had folks that spoke up, physicians, that what we bring to the table in our value proposition is that we bring the physician societies and the clinician perspective to the modeling effort. We engage our clinicians who help with our validation of our various models and workflows, and of course, testing, and then obviously implementing a solution for our patients, our customers. We got quite a bit accomplished. We did have some alignment to certainly work on. We had some new folks that, several new folks that came to the group. But basically, this is the summary. Activities and accomplishments. We focused on engaging with each other and harmonizing our 2020 definition of success that I covered in the opening community update. We revised and received consensus on our priorities. And again, that was around the why, the step-by-step guide, and then how to build a business case for the use of BPM plus health methods and models. It's all integrated for workflow optimization and real problem solving. We did develop that initial outline of some of the different sections of our document, as well as we took a look at the integrated view of the work group collaboration that came out of the Long Beach conference, the inputs and outputs. And while we feel that that was a great start, we want to go back and put details behind it and actually revise that working collaborative flow diagram, if you will, that map. We think that there's a lot of strength with, again, us working together and feeding each other information, that we're stronger in that collaborative community, that growth, if you will, and working together. We want to grow the community, and there's been a lot of work already done in this area. Ken, Pawan, and others have already been reaching out to medical societies and associations. We want to foster that work. We want to be engaged with whoever would like to do outreach. We stand with you and will certainly help lead the way and develop that value proposition of why people should join us in our journey. Expanding internationally, and let me just add that we had international people that were within our group. We thank you very much. We look forward to doing more of that. Next steps, we want to revise our new Trello workspace and can certainly utilize whatever comes out of the larger BPM plus health group. We have our Google Drive up and running and the connections made there. We have some work to do around revisions, updates based on some of our new direction. We look forward to scheduling our monthly work group calls, and we want to do Scrum type leadership calls if we can ask the leadership to pencil in their calendars some time that we can keep on track and keep them abreast of what the group is doing. We again want to work with the leadership across the work groups for collaboration. We thank those that could actually call in and provide us some feedback about how we can do that. We look forward to assigning responsibility for deliverables sections, being collaborative in the way that we're going to write. And I want to say, add to that, we had quite a bit of dialogue, like the adoption group, it sounds like, on the guide, the field guide. And we look forward to feeding change request updates for the next version of the field guide over the coming year. We actually started on our KPIs, and while we have some work to do on them, I think it also helped to summarize our work, point us in the right direction, and we will continue to refine those over the next 30 days as we finalize our plans for our deliverable. Issues and concerns, I added these: maintain a sense of urgency, engage a core team, frequent leadership checkpoints that we're on the right path. And then I had a couple of attendees that spoke about being double and triple booked due to sessions running concurrently. So I thought I would add that to the list. So Pawan, I'll turn it over to you, sir, now. If you'd like to add anything, summarize, please do.
Well, thank you so much. I don't have much to add. You covered it so well. The only message I have for the community is this was a very engaging session. We had some detailed discussion on segregation of how versus why, and that led to some good outcomes that we need to really focus on a business case for various medical societies and various adopters of the solution, as well as continue to focus on the detailed how as well in terms of input and output of various work products. One thing that was very revealing for this group was that authoring working group is kind of the secret glue that brings everybody else together. We start the process by bringing the business case or use cases, and then we disseminate that knowledge. We also bring back the feedback loop from the other organizations or other working group to improve upon our processes, because we are front facing and providing value to the end user. So with that, back to our next group. Thank you.
Great, thanks guys. Who's up next, Tracy?
Next, we have the methodology working group.
Good. I think Steve White's doing the outbrief for this. Robert sends his apologies. The OMG meeting is happening this week, and Robert is dual-hatted and has worked before the architecture board. So, so Steve is going to outbrief for us.
Yeah, hi, this is Steve. So yes, I'm standing in for Robert, and that just kind of emphasizes that this methodology group in some ways is probably the closest group tied into the OMG efforts and the OMG work, and many of the people in our group work in the OMG working groups and so forth. So so in terms of the methodology, the work we're doing, we are, one of the main outputs is the field guide, plus the BPM Plus standards, and also working to improve and increase the standard support. So we're involved in the OMG process for developing those standards. So this week, we didn't actually discuss the field guide much this week. I think since it had been recently released, and we're going to start getting some feedback, and as mentioned on the authoring call, they're going to start providing feedback to the field guide, and we'll be able to use the Atlassian site, and we already have a Jira project set up to track issues on the field guide for version 3. So we'll be able to get people involved with doing that. So as we get more feedback, we'll be able to apply that to the next version of the field guide, and we'll be able to report on that in future meetings. So in this meeting, we basically reviewed the standards that we are in the process of working on, that we believe need to be developed and completed to support the BPM Plus work that we're already doing. And so on Tuesday, we had meetings on Tuesday afternoon and also this morning. So on Tuesday, John Butler went through a review of the provenance and pedigree model and notation. We call that PPMN. And that discusses the lineage and the ownership of a particular event, basically anything, but it can be applied to clinical guidelines specifically for our purposes. We also reviewed situational data model and notation, SDMN, and I'll come back to that in a second. And then this morning we talked about the BPM Plus knowledge package model and notation, and this provides a mechanism for us to kind of package and wrap up and distribute the other BPM Plus models that are used to define the actual behaviors and decisions of a particular healthcare guideline, such as antenatal care or kidney disease and so forth. So this is an important standard that we are developing. And then this morning we also did discuss the potentially BPM Plus response for the COVID-19 virus. And so many of the people in the methodology group are certainly capable of helping in that effort. In terms of the situational data, that was probably the most interesting discussion that we had, and perhaps controversial in a way. So there's lots of discussion of how that fits in the OMG process and how to do that and the tactics and so forth. So this has kind of been an ongoing discussion since we first introduced this last September, and still is now. So we agreed, and then one of our next steps is to continue is a conference call. We actually have one already scheduled for next week. Many of the same people on the call, the OMG people, will discuss what are the appropriate tactics and standards. Are we going to submit this in RFC? I mean, there's other options for this. And there's some push to make this a more general, larger scale, data modeling standard. We're trying to resist that. At least I know Robert and I want to get SDMN, PPMN, and KPMN out there and have these specifications out there as soon as possible to help support, get some tooling behind it so that we can start packaging these models up and distributing them in a better way. And sometimes an OMG process will help with that, and sometimes it won't. It'll make things slow. So we're going to be continue discussing basically the process and some of the politics behind what can be done with SDMN. So that basically provides a concern. So the OMG process requirements and also politics around submitting new specifications, in particular SDMN, that is an issue that we do need to address, since we do have goals for all three of the standards to complete a specification by December, and having a complete specification that tool vendors could then go in and start creating implementation. So that is kind of the status of where we are now. Are there any questions on that?
Okay, thank you. Leonard Bender, is that Bo or Ken?
It's Bo. Hello, everyone. So as we mentioned on the initial discussion yesterday, that we had assembled a group last September, but hadn't really done much in the community as a community group since then. But I think this week was a chance to reinvigorate our group. We're gonna have some new people involved, some new organizations. There was great discussion. We have a commitment to meeting every 2 weeks going forward, and an interesting set of topics to work through. So I guess that was very positive that came out of this. I think I want to skip ahead to the last point here. I think we kind of hit the gist of what our group is focused on. We want to ultimately develop or implement models as software, but to do that, there has to be this balance between the consumers and the producers of model, or the consumers and the providers of models. We want to make sure that the model is self-describing enough and explicit enough that it lends itself towards software implementation. Yet at the same time, we don't want to overburden the authors of models to understand all the specifics about how to implement it as software. So for instance, if you create a model, but you don't know exactly what software platform is going to be implemented into, you may want to specify that the model has a place in it where you create a referral, but you don't necessarily know the details of the referral system that it'll be implemented into. In fact, there may be multiple different systems with different referral components that it gets implemented into. So how do you create a model once to use it multiple places and ensure that the clinical intent passes through without having necessarily describe all the different ways in which referrals can be done, or the ways in which terminology is done, or the ways in which decision support is done, or et cetera, et cetera. Not that I'm providing answers to the group, but I think this is the essence of what our group has to think about, and try and find that sweet spot between making the models descriptive enough that we have compliance on the other end, that the implementation is in fact a faithful and meaningful implementation of that model, yet not overburden the models to the point where they have to be completely aware of the target environments which they're being deployed to. Jen, anything you want to add?
No, I think that was one of the key things that we, that when we went through the data points that Bo and I had brainstormed prior to yesterday and today's sessions. A common thread that was running through it was precisely that, specifically the balance between the level of specificity that we can actually put on the authors to drive adoption and really increase the reuse of these models, while still retaining the level of flexibility required from an implementation standpoint. And the discussions in the last couple of days were incredibly helpful in highlighting some of the key areas of focus and the characteristics that we want to be considering as we move forward with those biweekly sessions with the working group.
That sounds really, really good. Thank you.
You're welcome. And thank everybody who took the time to join us during these sessions. It really, again, started off with, hey, here's some things that we had planned on last year. We really saw a lot of input, a lot of interest, and definitely looking forward to moving forward.
That's great. Anna, tell us about the launch. Or is it Lee?
Good afternoon. This is Anna Arlova, and I am a co-chair of Academic and Professional Education Working Group. I would like just to report that yesterday at our call, we launched our Academic and Professional Education Committee. By the way, one issue that we still haven't, we don't know what's the name it is, for these groups, community committee or working groups. So sorry for the inconsistencies in the standards environment. So, but anyway, we launched the Academic and Professional Education Committee. We discussed our focus and confirmed that we will focus both on academic education for medical schools, School of Nursing, Health Information Management Program, public health programs, as well as computer science programs within academic settings, as well as we will focus on professional education within the health professional organizations, hospitals, as well as other clinics, public health agencies, and standard development organizations. We specifically discussed the emphasis on certification of including these topics of BPM plus standards into certification programs for associations that might be interested to collaborate with us. And in a way, this content is shaping up our further efforts related to the tasks that we identified. And the tasks for us right now to decide is who we are teaching, what are our stakeholders and target audiences, what we're going to teach, how we're going to deliver the educational content, and who will teach. And that would include the assessment of existing informatics programs, as well as other training programs and courses that might be covering today or may be interested to cover this in the future. Those topics related to standardization, interoperability, and especially BPM plus standardization that would help interoperability moving forward. We discuss the need to review competencies that maybe those programs are using today, as well as some that might be under development in the future. And we specifically discussed the relation between our work as well as the adoption group that's working on the adoption framework, which for us may serve our internal competencies to develop educational materials. In terms how to teach besides the traditional way of teaching, lectures, tutorials, webinars, and so forth. We also discussed the need of tooling to be offered for our audience, that students or those who are interested in professional education. And we discussed the need for reference implementation toolkit or tooling at large. And we look forward to further discussions and work with other BPM Plus committees that may be working on the use of particular tools that we then can reuse in building our content. And we discussed the approach of train the trainer to see if the content that we will be developing across our different committees could be then offered to through the various both academic and professional education channels. And we have a robust group of faculty or trainers who can just deliver these materials at the various venues. Our next steps are just to have a regular calls. We selected Tuesdays, 2 to 3 p.m. Eastern Time. We will have this calls on a bi-weekly basis, and we will start on the April 14th. We invite everybody who is in the BPM Plus community current work groups to sign for our educational committee, because we feel that your expertise will be essential to help us to develop the content as well as to deliver it. We will be working on the APE Academic and Professional Education Roadmap for our initiative through 2020 and beyond, and I believe we are running a little bit behind the other working groups who already worked on the missions, goals, as well as particular deliverables for their committees. And with that, we'll just feel that we can learn from your already expertise and experience and put together our roadmap document. We also would like to set up the call for task force leads, and by task force is those tasks that you can see here on the activities and accomplishments above in item 3, because the review of current programs, competencies, as well as tooling is just an important thing for us to do. And we felt that besides the co-chairs, we need other leaders in this group to carry forward our work. And lastly, we talk about cross-collaboration with other communities, committees within our initiative, and also external liaisons that we may have with the different professional organizations and groups. And for that matter, we're also looking for liaisons from the BPM Plus community to us and vice versa, so that we could start our productive work. In terms of do we have issues and concerns, I'm sure some of them will come up, but not at this time. Anybody who participated in the meeting would like to add something to that?
Well, Anna, this is Lee. I just wanted to apologize again for having to miss yesterday at the last minute due to unforeseen circumstances here. But I think you have captured everything that we need to do, and I'm looking forward to having our roadmap, and mission and everything ready to go for our call on the 14th, because we are going to be busy working on that before we hit that call.
Thank you, Lee. And I would like to clarify that Lee, a real person who is working on COVID-19 epidemics, and therefore her circumstances were related to the safety of our nation and international community.
Yep. You did a wonderful job presenting what we have. I appreciate it.
Back to you, Kim and Tracy.
Tracy, do you want to cover this one? I'll wrap.
Yeah, I just added this slide here for some next steps. Let me take myself off speakerphone. That's better. So some helpful links. You know, if you're not yet a member or participant of BPM Plus Health, you can join on our site. There's also a link here to sign up for the working groups of your choice, and then we'll subscribe you, automatically to the respective mailing list for each working group. And then also on our site we have an event calendar because we host industry workshops and other public events throughout the year, separate from these working meetings. And we're looking at June in Orlando at the next OMG technical meeting. If that's still on, that will be our next workshop. And then following that, middle of September in Burlingame, which is right outside of San Francisco. And then we have a more broad mailing list. This is good for members, and if you're a casual observer, you can join us anytime. There's an orange button you'll see in the footer of the BPM Plus website. Join our mailing list. This is more for general announcements and updates. So join that list if you're more of a casual observer. And that's it for me, Ken.
All right, so I'll just quickly wrap things. So it's clear that just a tremendous amount happened this week. I just do want to spend a second and draw attention to the fact that this week is really indicative of what happens on these biweekly calls. So granted, the frequency was more and it was kind of a focused effort, but it's certainly not foreign to those that have been working. I mean, to call it the methodology folks, they've been on multiple calls a week, every week for 3 years now. So for those that we can and do get work done this way, and we'll continue to do so. Please, I've dropped some of the links, not all the links Tracy has here, but some of the links in the chat. So there's the link to the sign up to the email list, as well as the link for the COVID response. We'll be moving out on those in parallel, the COVID stuff and the BPM agenda. I want to take finally just last moment to acknowledge all the work that Tracy is doing and all of our support staff. So we've got Linda, Carrie, and Sharnita from Pivotal who've helped us with minutes and everything. We've got Tracy, who's just an absolute workhorse and keeping the whole community straight and organizing everything that went on with this event. Meg is behind the scenes. We probably didn't see as much of her directly, but she helps with all the agenda planning and all that. And so I just wanted to take a minute to acknowledge all of their efforts and thank all of you for making the time this week. So I think there's a lot of good stuff happening, and I look forward to really even picking up the pace from where we are. So thank you everybody for a successful week, and stay safe in your personal lives, and we look forward to working with you over the coming meeting cycle.
Thanks, everybody.
Thanks.
Yes,
Thank you.
thank you all.
Well.